If you're a parent, a caregiver, or an educator, you know just how vital communication is. But what happens when a child really struggles to find their words? Today, we're putting together a guide to help understand developmental language disorders, what they actually are, what to look for, and most importantly, how we can all help. We're going to break this down into 5 parts. First, we'll talk about what it means to struggle with words. Then, we'll dive into the causes and the warning signs to watch for. After that, we'll look at the path to getting a clear diagnosis, open up a toolkit of support strategies that really work, and finally, we'll talk about how you can be your child's #1 advocate. All right, let's get right to the heart of it. You know, for most of us, talking just happens. It feels natural. But for some kids, it's a constant uphill battle. Can you just imagine knowing exactly what you want to say, but the words just won't form correctly? Or maybe you hear someone talking, but the meaning just feels jumbled and lost. That's got to be incredibly frustrating, and you can see how it would affect a kid's confidence, their friendships, even how they learn in school. Okay, so let's clear something up that gets confusing for a lot of people. The best way to think about it is like this. A speech disorder is kind of like a hardware problem. It's all about the physical act of making sounds clearly. A language disorder, on the other hand, is more of a software issue. It's about understanding what words mean and knowing how to put them together into sentences. And it's really important to know a child can have one or the other, or sometimes even both. And this is so important to understand. These challenges are neurodevelopmental. That means they're tied to how the brain itself grows and develops. This has nothing to do with the child being lazy or not trying hard enough. It's not because of a primary hearing problem or an intellectual disability. Getting this right from the start is the first step to providing support without any blame. So this probably has you asking 2 big questions. Well, why is this happening? And what should I actually be looking for? Let's dig into the potential causes and those early warning signs. You know, there's hardly ever just one simple answer. The causes are pretty complex. It can be anything from a genetic link that runs in the family to complications around birth. It can even be connected to not having enough language stimulation in a child's early life. But most of the time, it's not just one thing, but a mix of a few different risk factors all coming together. One of the very first things a parent might notice is a delay in those super exciting milestones. You know, if a baby isn't babbling a whole lot, or a toddler's first words are showing up later than you'd expect, it's just something to pay attention to. And this can carry on, leading to them having a much smaller vocabulary than other kids their age. Another sign you might see is a disconnect between what a child seems to get and what they're able to say. Maybe they have a really hard time following simple multi-step directions. That points to a challenge with what we call receptive language. Or maybe their speech is just really hard for people to understand, which is a sign of an expressive or articulation issue. And you can imagine, right? All of this has a ripple effect. You might see issues with fluency, like stuttering. Social situations can become really tricky. And when a child just can't get their thoughts and feelings out, it often shows up as pure, visible frustration, or it might even cause them to pull back and withdraw. Noticing these signs is the first big step. The next one is getting some real clarity. Now, I know this part can feel a little intimidating for families, but it's actually a really positive journey toward getting the right kind of help. Think of a good assessment like building a complete puzzle of your child, one piece at a time. It'll start with their history and just observing how they communicate. Professionals will then screen for other things like hearing issues and check in on their emotional well-being. This is absolutely a team effort, with specialists and, most importantly, the family all working together to figure out how to best offer support, even at home. So once there's a clear picture of the challenge, we can zero in on the solutions. And this is not about fixing a child, it's about building a whole toolkit of support to help them absolutely thrive. The goals here are big and connected. Of course, it's about catching things early and giving the child direct support. But just as important is empowering you, the caregiver. The whole point is to encourage communication, build social connections, and create a plan that is flexible and can grow and change right along with your child. Real, effective support isn't just one single thing. It's woven into every part of a child's world. It's about creating a fun, stimulating environment at home. It's about the family using clear, simple language. It means turning therapy goals into fun games and activities. And it also means fighting for the right resources at school, making sure support is there for your child wherever they are. And that brings us to our last and maybe our most important part. No child and no family has to go through this alone. A strong, coordinated team, that's the real key to success. So often, a nurse or a primary care provider becomes the central hub for the whole family. They're a facilitator, spotting the early signs. They're an educator, explaining what's going on. They act as a coordinator, connecting you with the right specialists. And they're also a supporter and an advocate, making sure that the child's well-being and their voice are always, always the top priority. So that's really the big idea here, right? It's so much more than just therapy appointments. It's about this comprehensive, all-in effort where everyone, the family, the teachers, the healthcare providers, is working together. That coordination is what truly boosts a child's confidence, their relationships, and their overall quality of life. We'll leave you with this final thought. It's a really powerful question, and it pushes all of us to think beyond just a diagnosis or a therapy plan. It's a call for us to practice patience, to listen just a little bit harder, and to truly value what every single child has to say, long before their voice is perfectly clear. Thanks so much for joining us.